first of all, I want to congratulate the UICC on the huge success of the World Cancer Day. And I want to wish everybody in the United States happy Black History Month as well. Mayo Clinic Cancer Center is truly excited to partner with UICC for the World Cancer Day, especially given the theme of the next 3 years, which is dear to us, closing the cancer gap. So as you said, I'm a prostate cancer scientist, and my research focuses on understanding disparities and addressing disparities in Black men globally. It's such a great pleasure to be here.
Excellent. It says here that I should ask you about the care gaps that you've been addressing through your career. I know there are lots of issues with equity around the world in men's cancers, women's cancers, and also in low-income, high-income countries. But you've had specific areas of interest over your career. So perhaps you could talk us about the areas of inequities or disparities where you've spent your time.
Yes, absolutely. For me, I have been in academia now for almost 30 years, and the cancer care gap that has really touched me the most is the disparity in the cancer care for Black men globally, especially when it comes to prostate cancer. Black men are disproportionately affected by prostate cancer across the cancer care continuum, from prevention to screening to diagnosis, treatment, and survivorship. You know, whether you are in Africa, the Americas, or Europe, or anywhere across the globe, Black men are more likely to develop prostate cancer. They are more likely to get the aggressive form of prostate cancer. They're more likely to get it at a younger age, more likely to get it at a late stage, and more likely to die from prostate cancer. Closing the cancer care gap for Black men is really personal to me, as we have lost a significant number of Black men who have been part of our fight against prostate cancer. So, you know, unfortunately, Black men are less likely to also seek timely care, and they tend to have lower life expectancy when they're compared to women and other racial groups. So this is an urgent care gap that we really need to close.
You mentioned there that there's throughout the cancer control spectrum, there are issues and problems with Black men and prostate cancer. I'd like you to drill down a bit more about that issue you raised about men not being overly enthusiastic to go to a doctor or go to the hospital. And how big of a problem is that? And what have you been doing to try and overcome that?
Yes, you know, happy to share. First of all, you know, I want to let you know that when we are addressing health disparities, we need to address all the root causes of health disparities. And I don't want to take away from the fact that we have healthcare system factors, for example, access to screening, diagnostic, and therapeutic services. We also have provider level factors such as provider bias, including discrimination and marginalization of Blacks across the globe, and that has really impacted health disparities. But you know, for me, you know, as I've worked in different communities globally, the biggest challenge that we have has to do with individual level factors. And that includes the fact that men are not seeking care. So we have to ask ourselves, why do we have such a struggle with men being able to seek care in a timely way so that they can have timely diagnosis and timely therapy? It goes back to some of the things that they have on the personal level, social determinants of health factors, including the issue of unemployment, poverty, homelessness, you know, lack of access to care, finances, economic difficulties, social and community factors, as well as neighborhood and environmental factors. But in addition to that, and I'm talking to our Black men all over the globe, and I'm married to one of them, you know, there's this challenge that they do not seek care in time. There's this idea of being macho. There's this idea that if it's not falling off, right, everything is okay. But the problem is that when it concerns diseases such as prostate cancer, by the time you have the signs and symptoms, it's already at a late stage. So we really need to be very careful. We need to think about prevention. We need to think about informed, timely diagnosis. And our Black men should not wait until they feel the pain or they feel the symptoms before they seek care. We really want you to be to be around for a long, long time. And so it's very important for us that they seek care very timely.
I think your point's well made there. And there are loads of issues that we have to address in order to improve the situation. But One of the reasons we have World Cancer Day is to celebrate successes where we've made progress, where we can highlight something that's worked in one country or even one city and say, look, this can be achieved elsewhere. So what have been, what you say, the successes that you've seen in the environment where you operate, where you think there's some real learning here that could be deployed around the world? What are those things that, you know, you got home one evening and thought, my God, I'm so glad that's happened. That's really made a difference. What have they been?
Outstanding question, because we really do need to celebrate when we have successes, and we need to share the successes that we have so that we can learn from each other. First of all, I want to say closing the care gap requires partnership with the communities that are affected and using the framework that we use at Mayo Clinic Cancer Center, which is precision community health. You have to work very closely with the communities that are affected. And we use data and evidence to tailor the interventions to those communities so that we know that we are addressing it effectively. I'm going to give two examples of what really has worked very well that I feel can immediately be adopted or looked at to modify across the globe. First, I'm really proud of the Mayo Clinic Wellness RX program. So what is the Wellness RX program? The Wellness RX program actually focuses on addressing social determinants of health. And it focuses on food insecurity as well as wellness education in neighborhoods that have very high rates of disease and lack access to healthy food. That is predominantly one of the key issues why we have, cancer. So we partnered with neighborhood residents and community stakeholders to develop programs that addresses the needs of the community. And one of the things that they tell us is the fact that there is lack of healthy foods in their communities. And what Mayo Clinic did was partnered with Feeding the Northeast Florida to provide monthly grocery distribution to communities. Since 2017, we have had about 80 wellness events, across our catchment areas. We have been able to reach over 3,000 people at wellness events. We have distributed over 290,000 pounds of food within the neighborhood. About 90% of our participants now have easy access to fresh foods, and about 90% said that they now eat 1 to 3 servings daily. One of the things that I'm most proud of about this program is it has evolved into what we call community gardens. So within this neighborhood that we are working in, we are developing community gardens so that people can have fresh food within their neighborhoods. And we are now expanding it to mobile health units so that we can even do much more and decentralize care and clinical trials to these communities. The second one I want to highlight is what we are doing globally, because we do realize that for us to be able to close the gaps, we really need to understand what are the issues that are responsible for the gaps, whether it's biology, whether it's environmental factors, whether it's lifestyle, or whether it's behavioral factors. One of the things that we have found in Black populations across the globe is that there is lack of evidence-based research that will allow us to be able to tailor therapies and tailor interventions to the Black communities. So another way that we are closing the gap is to facilitate biomedical research, especially health disparities research, focused on Black men globally, especially in Africa. So one of the critical efforts of my consortium, which is called the Prostate Cancer Transatlantic Consortium, is to close the gap by opening biomedical studies and clinical trials in Africa. We currently have multiple prostate cancer studies open across multiple countries in Africa, funded by the U.S. National Cancer Institute, Mayo Clinic, Prostate Cancer Clinical Trials Consortium, November Foundation, and other agencies with over $5 million. I really am proud to share that 2 days ago, we learned that the Mayo Clinic Cancer Center led care grant, which is called the I Care for Black Men Consortium, received funding recommendation from the U.S. Department of Defense. With this fund, phase 1 is $3 million for us to effectively study what is going on in Black prostate cancer, Black prostate cancer patients across the world, including Africa. We have 5 countries in Africa that are part of this. And phase 2 is going to be a competitive renewal that is almost 10 million. So you can ask me, what are the impact of this kind of translating biomedical research specifically to address disparities and close the gap in these communities? In Africa, we have touched the lives of over 50,000 Black men. We have trained over 3,000 investigators who are really able to go back and work on closing the gap research. We have trained over 500 prostate cancer survivors who can advocate for manpower and advocate for policies to close the gap. We have unique biomedical discoveries that are now being tailored to train Black men. So these are just a couple of examples that I would like to give, and they are very critical to us to close the gap.
Folakemi, I wish I could capture your energy and enthusiasm and just transfer that around the world, which is why we're here, and that's why you're on this broadcast today, because World Cancer Day is an important platform for people like yourself and others to share that great news, to share what can be achieved, and to run away from the negativity of cancer and say, look, we can deal with it if we work together across country boundaries. So how important is World Cancer Day to you, and particularly the theme, which seems to resonate with everything you've said, which is about closing that care gap?
You know, let me just say, World Cancer Day has been really important to me for years. But when I got to know that the UICC is going to focus on closing the gap for the next 3 years, I am telling you, it was like Christmas came early for me. World Cancer Day is really a unique day that allows us across the world to come together and raise awareness about cancer. This is really very important for us, especially very important for us at Mayo Clinic. And we have lined up several activities. I'm sure a lot of people have seen our unique videos online. But at Mayo Clinic Cancer Center, we are participating in the UICC social media campaign. We have all our Cancer Center members who are joining in. We are using your social media toolkit to help bring awareness, you know, within our backyard and globally. We are sharing graphics on our Mayo Clinic, our Mayo Clinic Cancer Center social media channels and website. We are doing blog posts. We are doing, you know, different events on TV, on radio, and on YouTube as well. So this is really very critical for us because we have to bring awareness into what we are doing, and that passes on the information, and that empowers the community that we are working with.
I'm in a fortunate position that I can actually see everything that's happening around the world through my team. We're monitoring social media and we're picking up what's been announced around the world, governments launching new plans and things like that. So I'm glad you make the most of it, because this is the one time, I think, during the year when the whole of the cancer community, those who are passionate about prostate cancer, breast cancer, childhood cancer, the risk factors like tobacco control, we can actually come together and say, look, no, we are working in a concerted way to make the most of the opportunity we have to lower the cancer burden in the future and hopefully save more lives. I'd like to say thank you to the Mayo Clinic as well. So I know your colleagues also do a tremendous job, so thank you very much for that. If we look a little bit forward, we've got a couple of minutes, what would be your dream solution for prostate cancer in Black men? What would be a great result for you over the next few years?
You know, that is just a great question. I want to start by first of all saying that when we look at the statistics that we all quote, you know, they are linked to the pain, the agonies and tears of families across the world. Cancer does not only affect one person, it affects the family, it affects the community. And I have seen it firsthand. As I shared earlier on, you know, we have lost so many people to prostate cancer. Last year, one of the people that we lost to cancer was a research coordinator who worked very closely with me in fighting the fight for prostate cancer, you know, not only within the United States, but globally. You know, this is really tearing us apart. So we have to see cancer health disparity as a problem for all of us. It's not a problem for the few. It's not a problem for just a small number. We have to personalize it. And another thing that I would like to say is that health injustice for one is health injustice for all. And we all have to be committed to achieving health equity in our backyard and across the globe globally. So when you ask me, what would I like to see? What is my hope? My hope for the future is really not asking for much. I just have 3 things that I want to mention, right? One, we have to focus on addressing healthcare system barriers by ensuring that we are able to provide affordable and access to screening, diagnostic, and therapeutic health services, as well as survivorship and end-of-life care services for all globally. That is very important. We have to address provider levels barriers by eliminating bias, prejudice, and discrimination to provide better services. There is a lot of discrimination and bias going on in the healthcare system, and we really do not have time for that, because it is inhumane for you to do this when people are at their lowest point of health. Finally, I want to say we have to remove individual level barriers by improving social determinants of health. I want to say that one way for us to do this is I want us to get to a point that at every clinic, at every provider services in every community, that we have a screening tool to identify social determinants of health barriers faced by cancer patients. And we use that tool to connect them or navigate them to useful resources within their community, like transportation, food, free care, employment, housing, financial resources, education. Can you imagine, Dr. Adams, just think about this, if every clinic and every provider and every NGO have a platform that every cancer patient or anybody who is at risk for cancer can provide social determinants of health barriers, and almost immediately we tell them within your community, these are the resources that are going to help you out. Can you imagine how better off we will be? I mean, that would be my hope. That is my dream. If that can happen, I would retire happy.
Well, I'm sure there are many people in our community who would not like you to retire, because your energy is enthusiasm is incredible. I would say that, maybe from that, I could just say that on behalf of all men, the work you do is amazing. And also, as you mentioned, it's not just the men, it's their wives, their husbands, their partners, their children, their brothers, their sisters, their mothers and their fathers. So the impact you have is greater than the men that you help and who guide to hopefully get to the treatment early and they survive their prostate cancer. So thank you very much for all the great work you do. Enjoy the rest of World Cancer Day, and hopefully we'll meet up post-COVID when I can get over to your part of the world and say hello.
Absolutely. I look forward to doing that. Thank you very much. Thanks.
Thank you. Bye-bye.